Thank you. How's this? I tend to be a low talker, so if there are hands in the back that do this, I'll know to speak up some. So glad to be here. I was very excited when I got the call from Leland asking me to be a part of it with everyone here at the table. It's a really exciting topic, and it's really important to me. Very passionate about how we're designing for mental health, mostly because I believe as a designer we take an oath to protect the health, safety, and welfare of the public. And shouldn't that mean some of the most vulnerable of us, including those that are suffering from mental illness? So just a second about Gensler. Gensler is an international architecture and design firm. I lead the health and wellness practice of Gensler in the Southeast region, and we design everything from wayfinding apps, so we can help you out. Wait till wayfinding apps. Better? Yeah. All right, so I won't be able to help you design that. Clearly, technology and I don't get along. But Gensler does everything from wayfinding apps for health facilities to get people to their appointments faster with less stress. All right, 2 medical campuses, so large-scale planning on an urban level of hospital campuses. So my work really has focused on evidence-based design, which follows evidence-based medicine. Evidence-based medicine, of course, testing the effects in a quantitative scientific process, and we do that with the built environment where possible as well. And this really was, it kind of came about in a very high acute setting in a healthcare hospital patient bed environment back in the 1980s, but has progressed quite a bit from that phase. And in the bubbles there on the left, you see some of the things that we look for. Some of them are highly technical, like how do we design to reduce hospital-acquired infection, which is all about the materiality of the space as well as sink location. But really, it's grown so much and blossomed from that, and includes how are we designing for social support in a space? When somebody is ill, they need support, they need their loved ones around them. How are we designing appropriately for that? As well as the connection to nature, which has been touched on quite a bit. And not so much I just want something green, but the fact that you can connect inside a space with the world outside and a kind of normalization need for some of those suffering from mental health. So I've been working with our urban planning group. I'm not an urban planner by trade, I'm an interior designer. But we've been working so I've been working a lot with our urban planning group to infuse the work we're doing with these mental health research pieces, and how can we create what we've known to work in a single room environment or a hospital environment and scale up and scale out. This isn't just an individual issue. I think that's one of the reasons we don't talk about mental health as much as we associate with an individual. Well, that's just that person. They just had a problem. It's a societal issue. So how do we grow the scale and talk about it in that sense? And not that these are the only opportunities and elements and principles that do that, but these are the ones we've started to talk about in our organization. And the first being choice and control, and giving people opportunities to make choices for themselves in an urban setting, from how am I going to get there, what am I going to do with my time when I do get there. And when you give people a sense of control, they don't feel like they've lost it. So it's one more piece of control in their world and their environment that they can give them. It'll stop eventually. Okay. And so the second thing that we're looking at is safe spaces, and this is obviously safety and, all right, I'm so sorry about that, safe places, not in the sense of obviously we want children who are prescribed parks to have a safe route to get there and not fear any kind of violent attack or mugging or robbing or anything like that, but safe space in that if we go back to theories of biophilia, which is kind of looking at how the primitive mind connects with the built environment and the general environment around us, and thinking of vistas and refuge, and you want to see the prey, but you want to be protected from a predator. Our minds still work that way. We haven't evolved to the point where we don't have that yet. So creating those kind of safe spaces and environments, connection with nature, I think is one of the easiest to understand. And adding on to what we talked about in people's experience with parkland, so we also found that even in Montgomery County or Prince George's County right here near the city, 60% of children can't identify a vegetable versus a fruit, or they can only name 2. I mean, there's an educational component, and I think taking us to access, and not just accessibility if you have any kind of physical impairment to get around, but accessibility to all the things that you want to do. So first we have to cover the basics, right? Air, air quality, water, shelter, so mixing residents in. And then you get to kind of the education and health and support space. And I think it's hard to argue that you can have health without education, or that you can be educated without greater understanding of your health. Those two have to come together. And then you begin to add the amenity space, the entertainment venues, and keeping all of those accessible in a city block and a square mile or so. It's really important in improving mental health of that area. And then walkability, of course, the physical is obviously connected to the mental. We've decapitated the head and said, we'll treat it there, we'll talk about it there, but it's just too connected for us to continue to do that. So those are the pieces that we're starting to discuss in this arena. Some of the things that we are doing right now is in the app world, the technology world. We've created an app called Poppy Seed, and this is an app that we're using to emotionally map cities and places. And it started as a collaboration between our Chicago and Shanghai offices. So not yet out on the App Store, but a really fascinating way to look at the emotional side of the places where we spend our time and watch that data and see how things change and grow as we move along. Another thing that we do quite a bit of is experience mapping, and we do this at an urban scale level, a building level, and even a room level. And this is really about empathy. You can't design anything successfully without being empathetic to the people who are going to be using that space, whether it's a patient or someone who's occupying it or someone who's using it. And when you get into that empathetic mind zone of walking through in their steps, piece by piece, I think you have a greater understanding of what that space is going to mean to people. So that's something else that we're doing to kind of evolve and look at mental health in the built environment. And then lastly, we're doing large-scale urban plannings to create sites. This one is an example of some planning that we're doing for MLK Healthcare Campus in Los Angeles. And you can see there by the variation of green to white that there's about 50% green space mixed in with the built space. And we're creating special places within that campus. There's a mix of houses, residents, elementary schools, healthcare campuses, all within that kind of dense urban environment. We look to spread those tools and grow the urban grid out from that direction of a kind of holistic, healthy, mentally healthy and physically healthy city block in downtown Los Angeles.